Hi, my name's Eddie Mae Buell. I'm been with Community Hospice since December of last year. I'm kind of new to this program, but I've been in the mental health field for about 8 years. Um, I'm an associate social worker, so I'm working towards licensure for my LCSW, and I do kind of a lot. I wear a lot of hats here. So here I do children's grief. I do a palliative team, so I go out and I help patients with in-home care. And then I also do some bereavement counseling, and I am part of the Camp Erin. And that's kind of unique to our program here at Community Hospice. Is like in June, we take all of our kids that have been in bereavements, the ones that sign up for camp, and we have a whole weekend of grief camp, and it's really, really nice. Thank you so much for being here. I appreciate you guys coming out. There's going to be a couple groups that we do. Maybe you guys can like partner up or on some of the topics. So just know that that's going to be coming. So experiencing guilt. I don't know about all of you, but I know I've had several times in my life where I've experienced a lot of regret and guilt, right? I think it's kind of learning to grow. So advice with family caregiving, experiencing guilt or regret regarding decision making. All right. So first off, you want to really be kind to yourself, and you don't know what you don't know. When it comes down to situations where you find yourself making decisions and you don't really know the knowledge that you learned later after the situation happened, it can be it's good to learn things, and sometimes you wish you knew in the moment, but you got to be kind to yourself and just know that we're all human and we all learn to grow, and we just do the best we can in the moment. So you don't know what you don't know. How many people in this room feel like they could have done better if they only knew the information in the moment they needed it? Yeah. Everyone in here, raise hands. Yeah. Okay. I kind of want you guys to get together a little bit and just talk about what kind of situation was that. Like if it came to caregiving or currently caregiving, you can be in a lot of modes right now. It could be someone that passed away. It could be someone that's in the realm of being sick. Maybe someone that's becoming ill. All of those kinds of things, right? It all applies. So I kind of want you guys to get together and talk a little bit about that. I'll give you guys a couple minutes, and then I kind of want to hear around the room what you guys have to share, if that's okay. Okay. Now that you guys got a little bit of time to share, would somebody want to share? Okay, awesome. Here we go.
Okay. I live here in Modesto. My brother is real ill, and he lives in San Jose, no, Santa Clara. And a couple days back, he says, I'm going to have someone call you and I'm going to have them ship all my medical information to you online. And when somebody asks me for it, so I'm the middleman. He wants me to be the middleman. And I wanted to tell him no, but he's really sick. He's had a liver transplant. He's ready to get, he has a PICC line, so his kidneys, and he's had cancer before, and he's illiterate. So, he's counting on me to help him. He has a daughter, but she's overwhelmed, and he's married, and he doesn't trust there's a lot going on. So I should feel, good that he is asking me to, and he's trusting me to do this for him. But I wanted to tell him no, but I thought if I tell him no, I'm going to feel guilty and I'm going to regret it.
Thank you for sharing that. That is rough. That's rough. It's rough taking on a lot of responsibility, outside responsibility when we have overloading things that go on. Thankfully, like with us being humans, we have to we make connections, and we have to support each other when we can. And that's very good of you to do that. I'm very proud of you. Thank you for doing that. Does anybody else want to share a situation or anything? No? Okay. All right. Okay. Okay. What is the difference between guilt and regret? I just wanted to kind of talk about guilt and regret in definition first, and then maybe we can talk more about like if you guys have felt regret or guilt, like what led up to that. So guilt, a feeling of worry or unhappiness that you have because you have done something wrong, such as causing harm to another person. I think that's kind of a harsh example, but I mean, it could be that, or it could be like you let yourself down, like you had expectations and you didn't meet the marker, the things that you wanted to get done for that person. You feel bad because you weren't able to do something to the extent that you wanted to do it. It could be that too. Regret can be an incredibly painful emotion while rooted in feelings of contrition, disappointment, guilt, or remorse for things that have happened in the past. Such feelings can have a powerful influence over your life in the here and now. So guilt and regret. I kind of want you guys to get in your groups again and talk about an instance where you felt guilt and where you felt regret, and what's the difference between those feelings for you. I'm going to give you guys a couple of minutes, and I'm going to kind of share a little bit about my own experience with that, if you don't mind. But I'm going to give you guys a couple of minutes to talk, okay? No? Does somebody
I can share.
Go ahead.
I had a boyfriend, and he and I were together for almost 4 years, and he got sick. He ended up getting stage 4 cancer, and we weren't in a very happy place when he got sick, but I didn't want to leave him during that time, so we stuck it out until he was better and in remission. Things still didn't get better in the relationship, so eventually we broke up, went about our lives. About a year after we broke up, I found out he passed away. So much was left unsaid. I lived with guilt and regret for leaving things unfinished, for leaving things unsaid, for not being there, for not stepping up in a different way. But I did the best that I could. That is my story.
Thank you. Thank you so much for sharing that. Unless you guys want to share, do you have anything you want to share? Okay. Okay. So a tidbit about my dad. So when I was 15, my dad started getting really sick with his diabetes and some other things. And he was a veteran. He went to Vietnam. So Agent Orange kind of plays a part in all of this. So my dad got his leg amputated when I was a sophomore. And then after that, about 4 years later, he got another amputation. So this man bounced back from everything. He was always like, I don't know, he always lived by modeling. Like he was definitely my role model, somebody I looked up to. And he would bounce back from pretty much anything. And then come 2015, he was diagnosed with brain cancer, glioblastoma. Right. So he had a little bump on his head. They took it off, they biopsied it, and said it was benign. So, but then later on, we come to find out, like, I woke up in the morning and I heard someone groaning, and I went into my dad's room and I'm like, what's wrong? He's like, I can't breathe. So I like picked him up, helped him up, you know. We went to the hospital at Loma Linda at the time, and then he was diagnosed. And what really stunk was like he stayed overnight. So I went there in the morning again. And then they gave him the bad news like right before I walked in. So I was never there when he like had the news coming. It was always he had to tell me or give me the paperwork, you know, because I got there at like 8:30 and they had told him at like 8:00. And it was like, it's devastating to hear, oh, you only have like a year and a half maybe to live, you know. It's pretty, you know, it's just it's heavy. And then, you know, there's also talking to your loved ones about what their wishes are before they get into a place where they can't have that discussion. Or I know it's uncomfortable. It could be uncomfortable talking about those things, but it's kind of important to talk about those things because like once my dad was at home, I was taking care of him and stuff. It got to a point where I couldn't take care of him and he was declining. And he didn't want me to call the ambulance, but it's like, I don't know what to do. So then like he ends up dying in the hospital and I felt really bad about that. So I have a lot of guilt and regret about that because it's like I should have given the option of if he wanted to die at home. I thought he might have got surgery. I didn't know anything about glioblastoma really. We were thinking like he bounces back from everything. We're hopeful, but like he was also 67 with he had 2 amputations, high blood pressure. I mean, logically, anybody that knows anything about medical would know that he was not going to undergo brain surgery. But me being the optimistic child, like, that's what I want, right? And he ends up passing away. So I felt really bad and I had a lot of guilt and regret around that because I don't feel like I lived up to what he wanted. Like I didn't give him his wishes at the end. And it became a 3-hour drive from Loma Linda to San Diego because they were going to do the surgery and they transported him to San Diego. So the drive became from 45 minutes to 3 hours. So commuting to see him became even more of a hassle for us. So it was really, it was difficult. So that's my share on that. So steps to help guide decision makings of end of life is talking with your loved ones about their end of life wishes as early as possible. Talking about end of life can be difficult and uncomfortable. However, death is part of life and it does not have to be a negative aspect of life. Discussing the importance of planning ahead is a key element to creating a plan of action and a roadmap for each individual person. So after I read the last one, I kind of want to talk about if you guys have experienced that, if you guys, anybody in the room wasn't able to, like I kind of shared my story about that. And what's the difference when you're actually able to? If anybody had that experience where they had those things in place, did it make it easier? Like maybe you guys can talk amongst each other for a couple minutes about that. Okay. Okay. Does anybody want to share a little bit about like if someone's had their affairs in order? Has anybody experienced that where it was an easy transition? Anybody?
I'm not very good. I did go to a cemetery and I'm paying on a burial plot, and that was very hard for me to do. I thought I need to do it, at least I'll have that. And then I need to go forward with, other arrangements, but that's a separate part at this particular cemetery. So, and it was really hard for me to do that because I thought I need to do it because it's a burden on my kids, It's a burden kind of anyway, because when you're gone, they have everything's left for them. So, but it's not in my personality. I think maybe it was harder for me because I just don't like dealing with that kind of thing, but I don't think anybody does. So.
Thank you for sharing that. Okay.
When my grandmother passed, she had her affairs in order, so to speak, as far as having certain things were clear, but other things weren't so clear. And so I think maybe what I've heard recommended and seen is don't just have those things covered, also create some sort of documentation so that somebody can walk into the situation and not have any frame of reference and be able to follow your wishes and know how to get access to things, especially when it comes to financial stuff, it can be really difficult. So
thank you for sharing that. And thank you for doing that. That's very brave of you to do that. That's very uncomfortable. I haven't even, all the advice I'm giving, I haven't applied it yet. I mean, I need to do the same things. Oh, okay. Awesome. Else.
I just wanted to back up what the previous person said. I'm an ombudsman, so I deal with people in skilled nursing and assisted living facilities. And many of the cases I end up getting involved in is because the resident does not have an advanced health care directive and or does not have a power of attorney. So if those things can be put together for a resident, it makes things a lot easier down the road. When things get going tough, people get emotional and it's hard to, keep things moving ahead. So that would be my recommendation.
Thank you. Thank you for that as well. That was very important. Thank you, everybody, for sharing. That was excellent. I'm learning. Okay. So I don't know if you guys know what a pulse is. There is a pink paper. You guys all know what it is. That's great. Okay, awesome. The pink paper on the table, that's a pulse. It's an example. I'm becoming more familiar with it because I do a lot of palliative care, and it's really good to kind of know what the patient wants, right? In case it comes to that. So it's a physician's order for life-sustaining treatment. Form is written medical orders from a physician, nurse practitioner, or physician assistant that helps give people with serious illnesses more control over their own care by specifying the types of medical treatment they want to receive during serious illness. So you can obtain one from your primary or family physicians. I've worked with people that have a really, really hard time even wanting to fill it out because what you shared earlier, you know, even going to like make a plot or anything like that, it's just uncomfortable. And it's really like no one really wants to think about that, right? So sometimes it's difficult for individuals to fill out this form because it's overwhelming, it's serious, and you know, gently just, you know, talking about the uncomfortable feelings about it, kind of saying, you know, we all know that no one's promised tomorrow, anything can happen at any time, right, to anyone. So it's kind of, it's nice to even know, like, even if you had a conversation with a loved one that's super young or whatever age, and you kind of know like, oh, they said they wanted to be buried or cremated. They said that they did not want to be resuscitated, you know, or they talked about, you know, this life-sustaining treatment. All that stuff matters a lot because like when it comes down to the person making the decisions because the other person can't, it's like it all falls on them. The guilt, the regret, all that stuff, they carry that whole load and they do the best they can. But it's like there's a lot of things you learn after. Like when my dad had he had a heart attack or the day he died, like his heart stopped working. And then I should have done a DNR, but we resuscitated because I asked my sister in the heat of the moment. Like my sister's a lot younger than me, and she's all like, "Oh, of course, bring him. Like, you can keep him alive." And it's like his sternum was broken, like, you know. So that's yeah, it was hard to kind of see that too, because like no one wants their loved one to suffer like that, but we don't want to lose them either. So it's really hard. Does anybody want to go over the pulse anymore? Are you guys good? Okay, cool. Resources. So it's important because like when you're dealing with all of these situations, if you don't know anything about your county resources, I have a little hidden gem over here, which you guys actually have a caregiver's toolkit, and there's resources in the back of that. If you guys look at it, it's a really cool little book. I really like it. It's nice and neat, and you can put all your doctor's names in there, contacts. You can there's resources, a bunch of that. But there's also some brochures up here for some of the stuff that we do, like counseling. We do children's grief. You know, if you were on hospice services, a lot of people are scared of hospice, palliative, like they don't know what it is. Hospice, they run because they just think it's like you're sentenced to die. That's not always the case. It's comfort, right? But yeah, you do have a diagnosis of like, you know, within 6 months. But sometimes people pull out, and that's not always the same for everybody, right? So tapping into your resources can be helpful. Talking and asking questions with people that you care about, people you work with in the field, or if you guys go to events, and all those kinds of things is helpful. Do some research on the internet about your concerns, like go to YouTube. It's really, you know, the internet's a really good resource these days. There's some resources up here like Bridges, Stanislaus County, Department of Aging and Veteran Services, Senior Coalition of Stanislaus County, Modesto Senior Citizen Center. PACE is right over there off of Oakdale and like Orangeburg, I think, kind of in that parking lot. They're pretty well known, and they do a lot of good stuff. Like I said, there's resources in the back of the book, but there's also some resources in here. This is kind of just for our Hope Counseling Department. My people that I work with worked really hard on putting all the resources that we know of in there. So if you guys have any, time to browse through it, you can. Please don't take anything out of it. Take pictures, or if you want copies of something, let me know and I can make copies for you, okay? If that's something you guys want to look at, feel free to. Okay. Okay, so another really important element of taking care of yourself is self-care. So why do you guys think self-care is so important? Here.
Take care of other people.
Here.
Self-care, you have to be able to take care of yourself before you're able to take care of someone else. If you're not healthy or have a positive attitude, you're going to relay that to the person you're caregiving for, and that's not going to be good.
Good job. A lot of people just kind of run and they run out of energy and they do the most they can, and then they're not doing self-care, and then they're just overloaded and they're burned out. So a lot of people just do as much as they can and they drive themselves into the ground. Have you ever done that? Yeah, everybody. And then you kind of find boundaries, right? You discover ways of not doing that. Okay. So it's important. Understanding yourself, having boundaries, talking to people, make sure that you're taking care of yourself. Go to your doctor's appointments, do the checkups for yourself. They say 70% of caregivers end up, passing away sooner because they're not taking care of themselves and they're taking care of the person that they're caring for. So that's pretty high. That's substantial. It's important for caretakers to also take care of themselves. It's very important. We know it's difficult to find the time for self-care. So it's important to remember that your own wellness is still a priority. We also know caregivers may be too burned out to think of exactly what they need to do and what they can do to self-care. So in those times when you guys felt really overwhelmed and you can't think of any time that you have in the day to even implement self-care, what do you guys do? If you're too busy to even self-care, what do you do to get that self-care? I want you guys to talk a little bit about that. Okay, I'll give you guys a couple minutes. Okay. I heard a lot of chattering going on. So you guys want to share a little bit of your methods with us? Especially people that work full time, they have a family, they have no time for themselves, or any kind of situation you might be in. Or if you were in those positions before and how did you get through it? We have a lot of wisdom in these rooms. You guys want to share a little bit?
Couple of us were just talking about the benefit for support groups. I have a brother whose wife has Alzheimer's, and taking care of her is a struggle at times, but he's involved in a Alzheimer's support group, which he says is very, very helpful for him.
And then also sometimes when you're a caregiver, you forget to take care of yourself, or what you're supposed to do, but you make excuses or whatever. So if you have a person that you can go to that's going to remind you to do some things for yourself, so not necessarily a support group, but just even one person you can call and talk to, that could be a help also.
So what I found to be a helpful strategy when you're in a situation where, there's only 24 hours in a day, and really 18 of those can be used for anything and still getting a reasonable amount of sleep. You just make a list of all of the must-do items and prioritize that list the best you can, and try to schedule yourself even 20 minutes that you can spend with some quiet time. Sometimes that's very helpful, even though in the midst of stress, sometimes the last thing we want is silence. We just want to keep stimulation going, but sometimes it can be really helpful. So
Thank you, all of you that shared. It's really important to do some self-care. So any like an accountability partner, like what you were saying, you know, a group, you know, your family members, you might have one person that you confide everything into, and whenever you see them, they just kind of spark your mood. Like my sister is one of those people. I love my sister very much. And whenever I see her, she kind of like just makes me smile. My kids and my husband do too. But like she used to live kind of far away. She lives closer now, so I'm kind of happy about that. And when I see her, it's just, you know, it's a breath of fresh air. Okay. So just a list of some of the things that came up. Spending quality time with friends and family. Take time for spiritual practices, meditation, if you guys go to church, or if you guys have any kind of thing that you guys like doing, maybe Bible study. Let go of guilt. That's a good one. Like forgiving yourself, being kind to yourself, right? Being gentle with yourself. That's very important. And a lot of the time you kind of got to learn how to do that, because we can be really critical of ourselves. Joining a care group, support group. You were talking about the Alzheimer's group. I've heard several people that I've worked with go there, and they absolutely love going to that group, right? Stretch and breathe. A lot of the time we just forget to breathe. And if you're sore, you should stretch. Yoga is really good. Get some laughs. It's, you know, laughter is good for the soul. I don't know about you guys, but I like watching comedians. I like laughing. I like joking with my friends, and it's just good to feel, it's good to laugh. Talk to someone at least once a day, especially if you're caregiving, like use that phone, you know, go to a group, you know, like, cause you feel isolated and alone. It can be overwhelming. The walls get like smaller and smaller, you know. Get rest. Like you said, 18 hours of the day can be used for whatever. Was it 18 or 16? Okay, 16? Okay, I said wrong. But for me, it's like, yeah, 18. Yeah, realistically with the baby. Prioritizing your nutrition. It's really important to eat healthy. You know, it really affects your brain, the stuff that you eat. It affects your mood. It affects your ability to be energetic, lethargic, all that stuff. Ask for help. That's another thing. A lot of people don't know how to ask for help, or they don't have anyone to ask. So resources are another like really important element of that. If you don't have, like, you might be solo in your family and everything might be falling on your shoulders, right? Everyone has a different situation. So resources are very helpful for that situation. And then communicating your fears and needs with someone you can trust. Because the more you talk to other people, the more minds involved, the more answers you'll have, and the more options you'll have with the solutions. So that's always a good thing. And then advice to caregiving experiencing guilt or regret regarding decision making. So again, we kind of touched on some of this stuff, but for someone that's kind of going through it and they want to find a roadmap or try to figure out, like, where do I start? Making a list of things you need to know from the person you are caring for, and get those things answered as gently as possible, especially if the person's very like, they don't want to tell you, they don't want to talk about it. Maybe using examples of things that have happened, and like maybe talking about how like it's better to kind of know what the person wants, so then you're doing what they want instead of what you think's best. Spend time planning and discussing possible outcomes with the family, and get the support and advice from the collective if you have a family where you're able to do that. I know it can be hard sometimes where some, you know, end of life comes and there might be one sibling or whatever the situation is that's mainly taking on the whole load because everybody else is super busy. Get involved in a caregivers group or individual counseling. I think counseling is phenomenal. You know, it's really good to talk to someone about what's going on. It's confidential, and it's just nice to talk to somebody outside the realms of your family and your friends, somebody that you don't know. It's like fresh eyes, you know. However you feel about that, I know it's been helpful for me in the past. Try to get connected to resources and get all the support available to you and the person you are caring for. So resources are phenomenal. So if you know about resources, there's like bridges where they can refund you for like driving your person around to like activities and things that they're involved in. They'll reimburse you for gas, like things like that. People don't even know about those things. Try to encourage and assist the person you are caring to go to all doctor's appointments and has continuity of care. I know a lot of the time, sometimes like the people we're caring for, they do not want to go to the hospital. They do not want to do like, you know, some of them are very adamant and they will, but some of them don't. And it's really hard to take care of someone that doesn't really want to take care of themselves, right? So, and you can only do the best you can. And discuss end of life care early on, as early as you can. I feel like I'm going to go home and make sure that I talk about this with the people that are in my family so they know, and I need to start, you know, practicing what I'm talking about. Okay. And then you got to be kind to yourself. Forgive yourself for any regrets or guilt you may take on, and that takes time. The healing process takes time. Pain plays a vital part in our lives, and more specifically, our growth. Pain can provide feedback, tell us important information, and be the catalyst for positive changes. I feel like pain for me has been where I've learned the most. Like if I'm in pain or experiencing some tribulation, that's where I learn the most and I grow the most. So I'm actually grateful for the pain and the trials that I've gone through, because I wouldn't be here or know the things that I do know today without those experiences. And sharing your experience with others. Your tragedy may be the saving grace for someone else's current situation. So talking with other people. Talk about your feelings or write them down. There are a lot of people that don't like talking about how they feel or what's going on because they have to take on the weight of the world. But make sure at some capacity that you're getting it out, writing it down, talking to someone, whatever you need to do to get it out. And know you did your best, the best you could in the moment, and you don't know what you don't know, and that's okay. Does anybody have any questions or anything like that? Because I think we're... Oh, okay. Here you go.
Thank you, Eddie Mae. You guys were really interactive today. That was wonderful. Thank you for participating. We'd like to invite you to our next Community Connections on November 15th at 12 o'clock, and the topic will be on grief. If you need any additional resources, you can call us here at Community Hospice. The telephone number is 209-578-6300. And our presentation will be posted on the Community Hospice YouTube channel. If anybody online is interested in a caregiver toolkit for either Stanislaus or San Joaquin County, call us here at Community Hospice and we'll be happy to mail one to you. Thank you so much, everybody. Have a good day. Bye.